So today I'm going to present to you a post-hoc analysis of a study which we try to look at the response and also in terms of the efficacy and safety of Eltrombopag treatment in patients with persistent versus chronic ITP patients. Now, first of all, as you all know, immune thrombocytopenia or ITP is an autoimmune disease resulting in thrombocytopenia. And currently, the disease is classified into different phases, okay, according to the time from diagnosis. So within the first 3 months of diagnosis is usually called newly diagnosed ITP. And from 3 months to 12 months is called persistent ITP. And patients with a diagnosis of more than 12 months are usually called chronic ITP. We know in the bone marrow, the thrombopoietin actually stimulates the megakaryocytes to produce platelet. And in a number of clinical trials, we have already demonstrated that thrombopoietin receptor agonists can actually improve the platelet counts in patients with immune thrombocytopenia. And Eltrombopag is one of the thrombopoietin receptor agonists which is currently available in the market. It has been approved to be used in patients with chronic ITP who has already failed other forms of treatment, for example, corticosteroid or IVIG or any other treatment. So far, we have very few analyses. We try to actually look into the issue, whether the drug is actually effective or safe in patients with persistent ITP. That means patients who have been diagnosed with ITP 3 months to 12 months. So in this study, in this analysis, we're trying to present you the data from a phase 4 open-label study, an international trial, which initially we've conducted to evaluate the effect of Eltrombopag on the bone marrow fibrosis. So as you can see here, they summarize the design of the study. So basically, we have recruited patients with ITP, and we mainly exclude patients who have actually got recently treated with thrombopoietin receptor agonists within the past 6 months. And also, we excluded patients with severe myelofibrosis. That means MF grade 3, okay, according to the European consensus grading system. Okay, and these patients will then be treated with Eltrombopag for a total duration of 2 years. Okay, as you can see here in the slide, okay, you can see a few figures in circle. And basically, they summarize the dosage of Eltrombopag that we used. And basically, the starting dose of Eltrombopag was 50 milligrams in most patients, except those patients who are East Asian ancestry, because they usually have a high exposure to the drug. So we start with 25 milligrams per day. And then in all patients, the dose allowed to titrate to a maximum of 75 milligrams per day. And we did perform the bone marrow examination at screening before treatment, 1 year and 2 years after treatment to evaluate any change in the fibrosis of the marrow. As you can see here, in this study, we recruited patients who have got an ITP diagnosis for 6 months or more. So we did include some patients who are in the phase of persistent ITP. So this is a busy slide, okay, which summarizes the baseline characteristics of the patients that we recruited. We've recruited a total of 162 patients. As you can see here, close to 1/4 of these patients actually had persistent ITP. And about 3/4 of the patients has got a chronic ITP. Now, I don't want to go into the detail one category by one category, but I can share with you that in terms of the sex, the age, the platelet count, and the prior use of thrombopoietin receptor agonists, the two groups are actually quite similar in terms of the baseline characteristics. Although this is not exactly a randomized controlled study, and we don't do it actually by purpose. The only difference we can see between the two groups are the number of patients who have got splenectomy done. And this is quite expected because in clinical practice, we usually recommend splenectomy a little bit later. So looking at the overall conduction of the study, as you can see here, most of the patients actually completed the study. But of course, we do have some patients who withdrew earlier because either of the lack of efficacy or adverse events as summarized in this figure. In terms of the duration of exposure and the dose of Eltrombopag that we used, you can see that here we summarize the data on the persistent ITP group and the chronic ITP group. And basically, you see very similar result, both in terms of the median dose of the drug that we use and also the duration of exposure. This slide actually summarizes the platelet response that we see in this study. Okay. As you can see here, basically, if we take, say, using platelet count at least 50 times 10 to the power 9 per liter as kind of a safe value, which many of us use it, okay, to guide our treatment, you can see that without any rescue therapy, this level of platelet count was achieved in more than 80% of the patients in the study. It was achieved in about 84% of the patients with persistent ITP, and also in about 88% of the patients with chronic ITP. In the figure, okay, you can see that we try to summarize the median platelet count throughout the 2-year study period. And you can see here, the blue line is the patients with persistent ITP, and the orange line is the patients with chronic ITP. We see that the two lines actually overlap with each other very well, indicating that the median, in terms of the platelet response, the two groups of patients show exactly the same kind of results. Let's look at the platelet response in a little bit more detail. Okay, how quickly did it occur? Now, this slide actually summarizes the median time to achieve a platelet count of at least 50 times 10 to the power 9 per liter. Now, as you can see here, they're actually in both groups, the response occurred pretty quickly. It takes a median of around 4 weeks for the persistent ITP patients to achieve this safe platelet count, and a median of around 2 weeks for the patients with chronic ITP to achieve the safe platelet count. How about the sustainability? Is the response sustained? The answer is yes. As you can see here, if you look at, again, we summarize here, the blue bar is the persistent ITP, the orange bar is the chronic ITP patients. We see roughly about 2/3 of the patient has got a sustained response without any rescue therapy for more than 28 weeks, at least. And you can see that if you continue to follow this patient, there are certainly some patients who can actually achieve a sustained platelet response for even longer. And you don't see any difference in terms of proportion of the patients between the persistent versus the chronic ITP subgroup of patients. In about 40% of the patients in both subgroups, they develop a relapse of the ITP and require some form of rescue treatment. And most of these patients, as illustrated here, receive another new ITP medications. This slide is a busy slide. I don't want to go through line by line, but this summarizes the adverse event, the safety profile, including the serious adverse event. In summary, again, we see very similar safety profile in terms of adverse event between the patients with persistent versus chronic ITP, except a few, which I have highlighted here. We see a little bit more patients in the persistent ITP groups of patients with pain, some joint pain, some vertigo, and also some dyspepsia. But we believe that this difference is actually explained by the very limited number of patients that we have in the persistent ITP group. With smaller denominator, we certainly see, sometimes a little bit sort of fluctuation in the results. In this study, among the 37 patients on the left-hand side, okay, with persistent ITP, none of the patients died throughout the study period. For the chronic ITP patients, 3 patients died out of the 124 patients included. 2, unfortunately, died of cerebral intracranial hemorrhage. And again, this is actually an important cause of mortality in patients with ITP. There was another patient who died of acute respiratory distress syndrome. But none of these events were actually considered related to the drug. So we believe that the drug was actually equally safe in these 2 groups of patients. As I've mentioned initially, the primary aim of the study was actually to look at the bone marrow fibrosis that may be related to the Eltrombopag. In this study, as summarized here, again, on the left-hand side is a patient with persistent ITP, and the right-hand side includes the patients with chronic ITP. You can see that vast majority of the patients, they don't show any significant change in terms of the fibrosis in the bone marrow. Okay, so basically, the primary analysis of this study which was published last year in the Annals of Hematology, we have already concluded that the use of Eltrombopag is not associated with any clinically significant fibrosis in the bone marrow. And again, we don't see any difference between these two subgroups of patients. So in summary, ladies and gentlemen, in this study, although it's a post-hoc analysis, but I think we have shown that basically the efficacy and the safety following Eltrombopag treatment is actually consistent between those patients with persistent ITP versus those patients with chronic ITP. And the results in both subgroups are actually quite encouraging. So based on the data, I think we can conclude that even if we use the drug earlier, we certainly will give the same level of efficacy and safety. So before I finish my presentation, I would like to thank the sponsor of this study, Novartis, which has also provided some support in making the slides. But I would also like to thank all the investigators and the patients for the participation in this study. Without them, we certainly would not have the results in this post-hoc analysis. Thank you very much for your attention. I'm happy to take your comments and questions.